I'd like to welcome Makis Avgerinos to talk a little bit about the upcoming Venous Symposium meeting in Athens. Makis is a vascular surgeon and professor at the University of Athens and the co-director for the Clinic of Vascular and Endovascular Surgery at Athens Medical Group. More importantly, he's the co-director for the Venous Symposium in Europe and transferring one of the most popular venous meetings here in New York to the European arena. Welcome.
Well, Anil, thank you so much for the invitation. It's a great pleasure to see you, even virtually. You know, we have been working together in the past, and I miss you all guys in the States. But here I am now on the European side, discussing and getting the opportunity to present our new baby, the Venous Symposium Europe. And the Venous Symposium Europe is going to happen in Athens, October 17 to October 19. That's Thursday to Saturday. And it's the first one that's going to happen. We are kind of taking the knowledge that we gained through the New York Venous Symposium over the past 15 years. And, you know, I've been an integral part of this meeting for several years. And as I moved from the States to Europe, I felt that something was missing. You know, Europe lags behind, I would say, 5 to 6 years in terms of venous practice, in terms of venous education. And don't get me wrong, there are like wonderful venous sessions within the big meetings of Europe, but there's only one dedicated Venous Symposium in Europe. It's the European Venous Forum that is highly respected, but it's mainly a scientific meeting. It's mainly an abstract-oriented meeting, and it definitely has its role. But as you know, Venous Symposium, as it is in US, it has a different orientation. It's interactive. There are live patients, there are practical workshops, and it's a lot also industry oriented. So coming back to Greece and to Europe, I felt that was a good opportunity to get the knowledge and the expertise I got in US and get it in Europe. Because Europe still asks for education and experts to come together in a dedicated venous meeting. And I think this is what Venous Symposium Europe aspires to be.
So what specifically is going to be new with this meeting? What direction are you taking it in? It sounds like you're going to have more case-based or presentations and also some other components that are going to be a little bit new.
So as I said, I think Europe still lacks appropriate training and education. If you look around, there are probably 5 or 10 people who are doing advanced venous practice around Europe. So this meeting really is going to include everything from the basics to advanced techniques. What's unique in this meeting is the interaction with the patients. You know, there are patients on stage. We have Nikos Labropoulos running ultrasound, and then we discuss the case. People from the audience will jump in and say their opinion. I will do this or I will do that. We have practical workshops. Industry is heavily involved in all kinds of education in this meeting with workshops for superficial venous disease, for deep venous disease, for pelvic venous disease. There are going to be cases, there are going to be IVUS-oriented cases, and people are actually encouraged to submit their complex IVUS case, their complex venous case, and so on. But mainly it's very short lectures, 5 to 8 minute lectures by key opinion leaders from Europe, Middle East, Africa, and to spice it up, we also have a few Americans because we respect where we come from. And I mean, there are definitely so many good people like you in US, and we would like to spice up the European environment with the experience and the expertise from a few US speakers. And I plan to have every year 2 or 3 American speakers to to join our faculty, which is mainly right now European. We have 45 European faculty coming this year, and we're hoping to have a lot more attendees.
So who should be registering? Who should be attending the meeting?
Well, people who love phlebology. And this can be vascular surgeons, this can be general surgeons, this can be angiologists, this can be dermatologists, because there's also a lot of aesthetic medicine coming with veins, and people who do vascular medicine, people who care about lymphatics, people who take care of patients with pelvic venous disease. So as you very well know, veins is not the castle of a single specialty. Several specialties have interest and stakes in phlebology, and they are all welcome to attend. Actually, even the faculty is not just vascular surgeons. There are many other specialists involved. So we are welcoming everyone thinking venous.
So you have a vision for this meeting. Where's it going after 2024? Is it going to be an annual meeting? Is it going to be consistently in Athens? Are you going to be moving it around? What's the plan?
So let me introduce a little bit to the people who are behind it. Well, you very well know, but for the people who are attending this podcast, we got the branding and the knowledge starting from Tony Gasparis and Nikos Labropoulos from Stony Brook. And as I moved to the European states, then I was also involved and say, okay, we would like you, Makis, to run it. But Makis has been away from Europe for many, many years. So we needed a key opinion leader from Europe. And at the time, a good friend, an excellent surgeon and physician is Human Jalayev, from, I think, one of the top venous centers in Europe, Athens, Germany, also combined with Maastricht in Netherlands. He has been a key opinion leader in Europe for many, many years, and I think partnering with Human Jalayev would really help Venous Symposium Europe take off. So we are not only good friends, we are now partners in crime. So we are 4 co-directors, and with 3 of them being Greek, what do you expect? Where do you want this meeting to happen every year? And aside from that, Athens is a wonderful destination, and you will realize this when the time comes. Athens is strategically positioned between Europe, between the Middle East and Asia and Africa, and this allows more people, aside from US, because US people will still go to New York Venous Symposium. Maybe if you want to come to Athens too, but I think Athens is strategically placed, and if things go well, yes, the plan is to keep it up in Athens for the years to come.
It sounds like a great meeting. It sounds very exciting. I really like the new directions you're heading. I really like the outreach to places that have not had very strong venous presence before, and especially with not only Europe, but also Africa.
Yes.
I think there's a lot of potential there. So it sounds really exciting. Athens is wonderful. I think it's going to be a great time. I think a lot of people are going to either come before the meeting or after the meeting to go some of the island hopping or...
Yes, you can combine it with the islands. The weather is going to be actually mid-October. The weather is still warm. Tourism is booming in Athens. It's a wonderful destination. You can have souvlaki. You can listen to bouzouki and zorba. You can go to the islands and have some educational fun time with the people you more or less know, the usual suspects, in the unique way that Venous Symposium in New York has been settled over the past 15 years.
Marcus, thank you very much. Looking forward to the meeting.
Thank you so much for giving me the opportunity to present it. Thank you, Anil.